Do it again. Hi, I'm Dr. Varkey. Welcome back to GynoTalks. Today I want to teach you a little bit about the Zika virus and its importance in preconceptional counseling. The Zika virus is a virus that's transmitted by mosquitoes. Not all types of mosquitoes, only certain types that are found in certain parts of the world, but they're easily transmitted this way nonetheless. You can get this virus through a simple mosquito bite. You may not have any signs of infection, but still be carrying this virus in your bloodstream. If you're pregnant, that's very dangerous because this virus has been shown to cause multiple birth defects and many times even be lethal to an unborn child. What can you do to prevent this virus? Well, you have to avoid travel to those Zika endemic areas, but you also have to be understanding of the fact that even if you get bitten or infected prior to becoming pregnant, it can still affect a future pregnancy. So if a woman gets bitten within 2 months of becoming pregnant, we have found that she still could infect her child when she becomes pregnant. So we advise all women to avoid travel to Zika endemic areas for 2 months prior to becoming pregnant. Now, many people don't know that this also applies to the male partner. Men should avoid traveling to Zika endemic areas for 3 months prior to becoming pregnant because the Zika virus can not only live in their blood, but it can also live in the testicle and then be transmitted to their partner through sexual intercourse and semen. So it's important for both members of a couple to know this. Men should not travel for 3 months prior to conception and women for 2 months. While you're pregnant, women should obviously avoid traveling to any Zika endemic areas, and men can travel to a Zika endemic area if necessary, but when they come back, they should have sex only with condoms to prevent transmission to their unaffected wife. So even if she's never traveled, if he's got the infection in his testicle and they have sex, it can be sexually transmitted. So this is very important to understand even during the pregnancy. How do you know where you can travel and where not to? You can go to the CDC's website and look up the interactive map they have there. You put in the area of interest of where you want to travel, and you can narrow it down from the country to the state or province to the town, and they have things color-coded so that red indicates current cases of infection and purple indicates past infections, and so on. So it helps to kind of guide you to know where is safe to travel. And that's important because the doctor doesn't always have the most updated information, but the CDC is our place to go for that. And lastly, I sometimes get asked the question about what to do if you have no choice but to travel to a Zika endemic area. And what we tell our patients is just do everything you would normally do to avoid getting bitten by a mosquito. Wear long sleeve clothing, wear mosquito repellent, sleep under mosquito nets. That's as much as you can do if you have no choice but to travel to a Zika endemic area when you're thinking of becoming pregnant or while you're pregnant. So I hope this was helpful. As I always say, please talk to your own doctor for more detailed specific information to your case in regards to this and all other medical matters. But thank you for listening to this one, and don't forget to subscribe.